Welcome to BJS, British Journal of Surgery, Special Issue on Surgical Innovation. I'm Robert Hinchliffe, Associate Editor, and we're going to be discussing the special issue with Lord Darzi. The special issue is available online only, open access, and free to download via apps onto smartphones and tablets. Lord Darzi is Professor of Surgery at Imperial College. He's a surgeon, researcher, and innovator, and has supported the British Journal of Surgery for many years with highly citable papers in surgical innovation. He is currently Director of the Institute of Global Health Innovations at Imperial College. Welcome, Lord Darzi. How important do you believe surgical innovations to be?
I think it's absolutely vital in terms of the challenges facing us in healthcare, including surgery. Innovation is the only way in which we're going to address some of these challenges. Take, for example, the demographics of patients that we operate on now, the elderly population, some of the comorbidities that we see in the patients who are undergoing a surgical procedure. You'll come to one conclusion. You need to be innovative in the way you approach these challenges, because otherwise you're going to have huge challenges in both access, in both quality, but also in cost, which in the current economic climate is unsustainable.
How can British Journal of Surgery help to drive surgical innovation?
The British Journal of Surgery's role, I think, is vital, because the biggest challenge facing us at the moment, globally, isn't just the innovation, actually. It is what I described as the gap between what we know and what we do is getting bigger and bigger. So 30, 40 years ago, BJS was wonderful in really publishing and presenting some of the new discoveries. But I think the BJS now is not only doing that, but at the same time, actual fact, it's diffusing that very important message that there are solutions out there, there is a knowledge out there, that if it's translated in the right way at a local level, it could create a value, whether that is a health value or an economic value. So the BJS is in many ways the messenger in the world we're living in at the moment of social media and network. Beside the science of what we're looking at the same time, it is encouraging, infusing the reader in looking at other ways of doing things.
And you've had the opportunity to see the special innovation issue of the BJS. And were there any particular papers that caught your eye?
You're calling it a special issue. I think it's very special because you've dedicated one specific issue and looking at some very easy solutions in some areas, in tackling some major challenges. One being clinical trials, which are, we know, extremely expensive, very difficult to do in surgery for all sorts of different parameters. And the editorial looks at this as well. Is there a different angle in which trials could be designed? Our obsession with randomized controlled trial, and we need to be absolutely clear, we have to stick with the principles of quality and research, but at the same time, looking at it through a different lens was very refreshing. At the same time, we're looking at what I call frugal innovations, low cost, high impact, some of the work in using mosquito nets in the global health arena in terms of hernia repair, up to the most sophisticated end of tissue engineering and tracheal reconstruction using stem cells and other opportunities there. So it's a wonderful addition, really covers anything from technological innovation to process innovation. Let's not forget process innovation is extremely important.
And who do you think should read the special issue?
I recommend it anywhere from a medical student and all the way up to the most established surgeons, not just in this country and globally. In actual fact, the reputation of the BJS when I go abroad is absolutely huge. We've seen in terms of its impact factor and its citation dramatically improving. So, and may I just say, that's the surgical community, but there's a huge amount of policymakers out there who need to understand what surgery is all about. There's also allied healthcare professionals and nurses who could really benefit from reading, especially this edition, if not the BJS as a whole.
Critics of surgical innovation have suggested that surgical innovation offers complex and expensive solutions to complex problems. Do you think we can really afford surgical innovation?
I don't agree with that thesis that surgical innovation is inexpensive and there to address big problems. I'm a guy who led technological innovation in robotics for many years. I used to describe, and I still describe myself, that area of research was about high cost, low impact technologies. May I just say there is an opportunity for innovation of anyone reading or listening to this blog, and that is innovation doesn't have to be expensive. In actual fact, my interest at the moment is frugal innovation. What could we do with low cost, high impact innovation? And there are wonderful examples in the BJS in terms of frugal innovation. So these could be simple things. You know, if you are a registrar or a resident reading this edition, there are wonderful examples of process innovation in which you can improve quality and safety without any cost. So it's very important to re-emphasize and also change the mindset of policymakers that surgical innovation isn't about high-cost technologies. It's about actually improving quality, improving access, and improving the cost-effectiveness of whatever we do.
And do you think there are some good examples of surgical innovation in low-income countries?
I see wonderful opportunities for surgical innovation in low-income countries. In actual fact, we are seeing examples of that, certainly in the southern hemisphere in the East. And we have some wonderful in-depth case studies looking, for example, at the Aravind Center in India, who do cataract surgery, 250,000 cataracts a year. And if you look at the process innovation in that type of setup, including some of the technological innovation in low-cost, cheap lenses, they are, turning through large number of patients, and they've done some quality outcome studies in comparison with us and what we do in the NHS. And you certainly come to the conclusion that a lot what they're doing, we can learn from, not just what they're doing at a local level. And the dynamics that are driving that innovation in those countries, certainly the emerging economies, is very different than us. Change is very difficult to do in the Northern Hemisphere. Change seems to be easier to do in the Southern Hemisphere because of other dynamics. And I think the BJS has done a good work in capturing some of the innovations globally.
If we now move on to an area of surgery, of vascular surgery, which is a specialist interest area of mine, there have been very major changes as a result of surgical innovation. Do you see any opportunities specifically in that area?
Vascular surgery is a wonderful example of what I'd call a disruptive innovation, in which the technology has disrupted the previous incumbent, and that is your classical open vascular surgery. But to be fair to the vascular surgeon, they've taken the mantle and they've adapted to that change in learning the skills of intravascular surgery, which is the stent era that we live in. And that's what surgery is all about. It's about adoption. It's about able to change. And I think we've seen, in a very short period of time, in about a decade, vascular surgeons have transformed their practices. I think there are similar opportunities in other areas of surgery. And, in my time, usually in a lifetime of a surgeon, you will come across possibly, if you're lucky, one disruption. In my life, it was laparoscopic or minimally invasive surgery. You might be lucky and get two, but you should always be out there waiting for the next big disruption that may happen. I think the decade before, in my training days, was PPIs and ulcer surgery. So being ready for that disruption and adopting, as vascular surgeons have done, is very, very refreshing to see.
And looking to the future, what do you see are the real barriers to the introduction of surgical innovation? And where do you think the real opportunities lie over the next 5 to 10 years?
I think there are major challenges in the diffusion of innovation. And last year we did a global study, which was published in Health Affairs, looking at what are the enablers of innovation. And we're quite clear, if you have a strategic direction, if you have a vision, if you're investing in research and development, if you have the right workforce, then these are wonderful enablers. But I think on top of that, despite having these factors, we recognize there are certain what we call cultural dynamics in every institution. And these are, for example, are surgeons being given the time to think? Have surgeons been given the time to take risk? Innovation carries risk. Do they feel supported? in taking that risk. It's not just about money, it's about do they have this space in which they could actually translate some of that evidence into their clinical practice. In other words, education and training comes into it. So these are very local, and that is ultimately based on the leadership of that organization, really going all the way from the board to the ward, and how is that organization nurturing innovation and really encouraging their workforce, including their surgeons, in really translating that knowledge base into patient benefit.
Professor Darzi, on behalf of BJS British Journal of Surgery, I'd like to thank you for this important contribution to the special issue on surgical innovation. Thank you.
Thank you for having me. Thank you very much.